One of the great things that you pointed out is that when Medicare was passed in 1965, but we continue to work to improve it, to make it better, to even expand the coverage so that it is more affordable for the elderly. This is a work in progress. It's really been a job that has been the life's work of the Democratic Party for generations, to make sure that Medicare really does do what it needs. You know, when Medicare first came into being in 1965, prescription drugs were actually a very small part of the whole health care costs. Mm-hmm. And now they are at the center, front and center often, of extending life, of making life more livable, of preventing death. And so we work to find all the ways that we can perfect what has been a very successful program. I want to once again just make sure that people see the advantages to older Americans, how healthcare reforms mean security and stability for America's seniors, extends the life, that's what solvency means, extends the life of Medicare, lowers seniors' costs for prescription drugs, improves the quality of seniors' care with better coordination among doctors, trains more primary care doctors, so there'll be access when we add more people to health care. Some seniors are worried. Okay, you add 30 million people to the health care coverage. Are there going to be enough doctors? We say we've got to do that. That's what is in this bill, to make sure that we train and create incentives for more primary care doctors, nurses too, so that we have the professionals that we need. And covering the cost of preventive care for Medicare patients, you described that. That's for things like mammograms and colonoscopies. No out-of-pocket cost. Expand home and community-based services to keep seniors in their homes. So the question really is, what is the Republican plan? If they say our plan is bad, well, Paul Ryan, one of the up-and-coming Republicans, proposed the plan. He's the top Republican on the House Budget Committee, and he put forth what they call the roadmap. The Republican roadmap wouldn't improve Medicare. It actually ends it. Now, are you thinking, oh, this is all partisan, you know, that can't be true. But it actually is true. It would end Medicare for get to be 65 for everyone who is now under the age of 55.